Okay, folks, I'm just going to chime in here. We're going to a minute or so before the hour. I'm just going to do kind of an elongated introduction, as I like to do sometimes. My name is Jeff Clark. I'm a regional director here with GoldenCare USA. I've been with the company for over 24 years now, I guess. Did a lot of selling, still do some selling. I mean, typically my job is to recruit, train, and review products and help agents out with where to sell, when, what product to use in the right environment. I can tell you from experience, it's still selling a little bit, but when I tell agents where to go, how to shop, compare, look at a certain market, a certain zip code, CSG is invaluable. I mean, this is such a great tool. And again, I want to appreciate and thank a lot of you guys for coming on. We're still getting people locked in here, I guess. But what a fantastic tool. And if you're looking at a competitive analysis landscape of any area in the country, you've got Supplement, Advantage, and now they've added hospital indemnity, final expense, so many dental and vision, so many great things here. I'm not going to steal Anna's thunder a lot. She's been going through some of the newer features, comparison things in here. I can tell you that I use this daily. Personally, I mean, I talk to brokers or agents, for most parts of the country, and they'll call me and they just want to know maybe how to get started in the Med Supp area. I'll tell them what's the zip code. We'll take a look. And if I want to know who's have the best rates for Plan G in any given zip code in America, I can find that instantaneously. Just one example is how invaluable this tool is. So if you're in the Medicare arena, even the final expense or some hospital indemnity, I can't say enough about CSG Actuarial. What a great tool. Anna Patrick, I know she's been with them for a long time. She knows her stuff, and I get to learn something every time that we do these things that Anna hosts for us. So she's going to go over some newer features on this product, and I can't wait to listen myself. So thanks a lot for coming on board, and I'm going to turn it over to you, Anna. Go ahead.
All right. Thank you so much. And again, I appreciate everyone's time today jumping on this training. We're really excited to offer additional quoting resources to you GoldenCare agents. So when you sign into the quoting platform, you have probably seen in the last couple of months some additional tools on here, just more carriers on our e-application platform. We were really excited to launch United Healthcare on our e-apps. So that's kind of a newer carrier on there. We have added our new Medicare Advantage and Part D quoting, which allows you to enter in a client's prescription drugs and preferred pharmacies. We have our own electronic scope of appointment and document locker, and then our client management system, which is great for you to upload your clients into the quoting tool. It allows you to store some basic information and then run some bulk quotes, and also create those client segmented lists. So I'm going to go through here covering a lot of these newer features, and I'm going to go ahead and start with our e-application platform. So a lot of you have probably have been familiar with our quoting system. So I'm not going to cover too much in depth on how to run quotes necessarily. Pretty easy to go in there, enter in a zip code, plan type, effective date, and get quotes for carriers. But what I want to kind of shift gears on are these newer features. So I'm going to go into e-apps here. Yep.
I just want to say one thing. I'm so sorry to interrupt. I forgot to mention too. So for questions, folks, you can go ahead and maybe just type in your questions, and maybe when she's done, I'll go through and just kind of highlight some of the more common questions, and we'll answer a couple of them at the end, Anna, if that's all right.
Yeah, that sounds great.
Okay, just want to put that in. All right, go ahead.
Yeah, no worries. So we do have our new client manager system. Client manager, this allows you to import your clients into the quoting tool. So you can see here, I have my list of clients here. To import your clients, all you would have to do is click on this import button, so you can import your clients just with an Excel file. In the upper right hand corner, we have our training guides. These are a great resource on how you can upload your clients in here. We have a sample Excel file that you can use as a reference for all of your column headers, or you can manually add a new client here as well. But what's great about having your clients in Client Manager is that it's a seamless process when you go and you run quotes, and especially when you start an e-application. So within each client profile, we can store some basic information about them: first name, last name, phone number, email, address. It's also going to break down all of your quoting history for them as well. So when was the last time you ran a quote, what quote type, and then you can easily rerun those quotes for them. You can also import any any of their current products into here. So you can see what plan type they're currently on, what carrier, and then their plan premium. So this just kind of allows you to effectively track your clients. Within Client Manager, we have a very unique quote option, and this is a bulk quote or multi-client quoting. Essentially, this allows you to quote multiple clients at one time. So if you purchase a lead list, or maybe you have a lot of clients who are on a certain block of business and that carrier just took a rate increase, and you want to go out and re-quote all of those clients with a click of a button, you can do that within Client Manager. You can filter out your clients. So for example, let's just say Aetna took a rate increase. You want to reach out to those individuals, or you want to go and re-quote them. You can select Med Supp carrier. You can type in Aetna, and it's going to display all of your clients who are on an Aetna plan, for example. You can add multiple filters into this tool as well. So you can do those different filterings, or you can just select clients this way too. So when you do select your clients, you have this you'll have an option to do what we call a bulk quote, and that's just quoting multiple clients at one time. I'm going to switch gears and show you that here in a second, but just wanted to kind of quickly show you what Client Manager does, because it will populate into your eApp system. So because I do have clients in my Client Manager, when I go and I run a quote for an individual, I can select a client from my client applicant drop-down menu here, and then it automatically populates all of their information for me in the quote. So again, it's just kind of that seamless process there for you. Just pulling up a new window here. I'm going to pull up a testing environment so I can show you our eApp platform here. So when you select that client from your client applicant drop-down menu, again, it's going to automatically populate their zip code, their age, their gender, and then you can select your plan type. You can choose your effective date, whether you want to include a household discount or not include a household discount. So as I mentioned earlier, we do have our e-application platform. What this allows you to do is take an application right on our quoting tool. So instead of having to go directly to the carrier's website, re-enter all the quote information, you can quickly take an application right on the quoting tool. What's unique about our platform is it is going to be the same look and feel for every single carrier that is on that eApp platform. So no matter if I'm submitting an application for Aetna, Mutual, United Healthcare, the look and the feel and the process is going to be the exact same. So it really kind of helps you in a process to really only having to learn and understand one carrier. So we have what we call a client shopping cart. And what that allows you to do is you can add a product to a client shopping cart. So you have your client shopping cart in the upper right-hand corner here. So when you do click Add to Cart, it will put that individual's plan in here. So I did carried over Tim Jones here. I could go and I can run a dental plan, and I can put the dental plan in here and do one checkout process for multiple products across companies as well. So let's just say, for example, I'm going to just do a Med Supp for this individual here. You can bypass the cart if you wanted to, or you can just hit that apply now button. But what I like about using the shopping cart is any of the individual's information that I have stored in Client Manager. So I showed you how we can input their phone number and their email and everything like that. You can see here on this app, as soon as I get into the app, it automatically carries over my individual's email address. It carries over the mailing address here, the phone number. So these are all items that I automatically had in that Client Manager. So in that way, it's really easy and kind of speeds up the application process when you have all that data stored in there. So this is a Mutual of Omaha app. It's going to be the same if I was doing an Aetna or United Healthcare. So it automatically carries over the quote information. All of our applications underwrite in real time. So if you are going through an underwriting and you enter yes to a decline health question, or you enter in a declinable drug, it will notify you of any of those in your notifications tab. Going through this application is pretty seamless. I won't spend too much time going through it just for time purposes, because I want to cover a lot of other topics here today. But it's really easy. You can hop around through the different sections and go through and complete them. We do have different signature options available as well. All of your applications do store within your e-app panel. So as you're going through this application, it does save. So if you need to get back into it, you can always get back into it by going into your e-applications panel on your dashboard page. So again, a great resource for you to quickly submit an application right on the CSG quoting tool. All right, I'm going to switch gears here a little bit and get into our new Medicare Advantage and prescription drug quoting. So again, with Client Manager, it allows you to save all of your clients' prescription drugs and preferred pharmacies. So to get into our new Medicare Advantage and Part D quoting, you will use our newer V2 beta version that we have labeled there. But same concept as the Med Supp, you would just come and you would select your client in your client applicant drop-down menu. And if you have previously ran a quote for an individual and already stored their medications, they're going to automatically populate up here for you. So you can enter in those prescription drugs and those preferred pharmacies, and you can get your quote here. So let's say this is my first time filling it out for an individual. I would have to go through and select them, or if I don't have them loaded, I can always just come and create a new client this way as well. So I do have some different options in doing that. So let's just say I type in her zip code. I would select the plan, whether that's Medicare Advantage, Medicare Part D. So we do have just those Part D plans in here. The low income subsidy level, so you can select that. We have new options for sorting, whether that's annual drug and premium costs or annual drug deductible. We would have show drug costs, and then the fill method, whether that's retail, mail order, or both. Then from here, you can just start by adding in those drugs. So as you start typing in a drug, you can select that drug, whether you want to allow generic drugs or substitution. So if I have this toggled on, that means it is going to pull up my generic versions. If I would have this toggled off, I'm going to get the brand name options here in parentheses. So just pay close attention to whether you're selecting a brand or a generic. Some plans do not cover the brand names, but they do the generic version. So just kind of pay close attention whether you have that toggle on or off. You can select the quantity, the frequency. So if you were doing it every 3 months, just make sure you move your quantity to 90 instead of 30. So you can keep this open to add multiple drugs. So as soon as you add that drug, it will populate here in the background here. Then just adding the pharmacies, it will automatically populate that zip code that you entered, and then you can go through here and select the pharmacies. You do have an option to select multiple pharmacies as well if you're looking to compare costs. So from there, all you would have to do is hit Get Quote. Now, that was my first time running a quote for this individual. The next time I go and I select their name from my applicant drop-down menu, all of those drugs and pharmacies will populate similar to that first client that I showed you how it automatically shows. So just one time you have to enter in that client's drugs and pharmacies. The next time it automatically saves here. So our quote results page looks a little bit different than the previous version here, but you can see that we are going to show you some information, health and drug coverage, or if it's just health coverage. Again, I ran just a traditional Medicare Advantage plan. We have the RX drug cover, how many drugs are covered, how many pharmacies are covered. We have your health, max out of pocket, drug and premium costs. I really like our market data that we have on the MA side. So if you click on that Show Plan Highlights and you scroll down a little bit, we're going to show you the county enrollment and company enrollment numbers. So this is just telling you, out of everybody who is eligible for a Medicare Advantage plan in this county, how many people are actually enrolled. So in this Dallas County, about 40 to 47% of the eligible MAs are enrolled in one. The others could be still in a group plan or on a Med Supp plan. This just kind of tells you how many people are enrolled in one. And then based upon that, how many people are enrolled for this company and this plan. So you can really see which plans are popular across different companies. So you can always review that data too. I know a lot of individuals are curious on those. What are other people enrolled in? What are you seeing? What are you selling? This information can become extremely valuable for you. So then in order to start reviewing all of the costs, all you would have to do is click on that name, and then we'll show you the overview. We'll show you all of the benefits and the costs. So what are the copays, what's covered, what's in-network, out-of-network. And then the our extra coverage and costs, this is where it's going to break down the drugs that you entered. So we're going to break down the cost, the different tiers, what the initial coverage, the gap coverage, the catastrophic, what drugs you entered, whether they were brand or generic, what tier they belong to. And then based upon the pharmacies that you entered, what's the cost retail, before, after deductible, in coverage gap, and after gap costs. And then we'll break down the remaining of the year for you. So since I ran it today, when you start running your 2022 plans, it'll break down January all the way through December for you. So you can really evaluate what coverage phase that they will be in depending on what month. So this new Medicare Advantage quoting is very helpful as we get into AEP and just looking over all of those different drug coverage and costs. All of these, you can save it, you can print it off, so you do have that option still as well. Similar to our other tools, we do have that comparison feature where you can select multiple plans at once. So you can just click on the little green check mark here, and you can start comparing costs. All right, I'm going to go back to my dashboard page here, kind of staying on the Medicare Advantage side of things. We do also offer you the ability to capture a generic scope of appointment on the quoting tool. So you will see two things here. You'll see this electronic scope signing and your document locker. So your electronic scopes, it's just, again, kind of self-explanatory, allows you to capture a scope electronically here. This is a generic scope, so it does not have any company logos or anything like that on there. And people always ask, what's the benefit of doing a generic versus using the carriers? And I always say, well, you're not too sure which carrier you're going to go with until you start talking with them. And in order to talk with them, you need that scope, right? So you can go ahead and start your document. You can also preview it, so it is a generic scope that if you did just want to download a copy of this and take a paper one, we do have this generic option available that you can download and print. But in order to start that scope, all you would have to do is click on Start Document, give it a title, and hit Save and Continue. This is just agreeing to the terms and the conditions of that electronic signature. So you'll scroll to the bottom and select I agree. And then we do have two signature options. So if you are in the same physical location, the applicant can provide identification information, or we do have, if you're not in the same physical location, you can do that email signature link. So the email signature link is really easy. All they would have to do is open up their email and click on the link in the verification code and complete it that way. it might be helpful for me to show you the email signature, so I will do that one, thinking that maybe many of you will be doing these electronically and maybe not be meeting people face to face. So I'll just show you the screens of the email signature, just so you're kind of more familiar with it. Again, I do recommend that you get in here and you practice maybe taking a electronic scope or doing the email signature option and maybe just using your own email as a sample. It is really easy, but it's kind of helpful for you to walk through it yourself before you do it with an individual. So let me just pull up the email here that I received. So you can see what that looks like here. So this is the email that your client will receive. So they'll open up their email, they'll copy or write down their verification code. They'll click on e-sign your document. They'll enter in their verification code and hit verify and continue. They'll just scroll to the bottom and agree to the terms of doing the electronic signature. And then they just have to select which plans they want to discuss with you. So they can select those plans, they can type in their name, and then their signature is just acknowledging the city and the state that they are signing in. And then they'll just check mark apply e-signature and then sign and complete. So it just says your signature has been received. So you, the agent, will also receive an email letting you know that that individual has signed their scope. You could go back to your page here, and if you go back to your documents, I'll pull up, this is the email that you're going to receive, just letting you know that that client, it was applied. So you do get these notices in real time, so that's helpful. So I can see here my client, it says sign waiting producer data. So before your appointment, you can get into here, you can click on their name, and then you can go ahead and hit continue here, and then you can preview which items they agree to discuss with you. So if you scroll to the bottom here and if you hit preview, you can see here which products they agreed to discuss with you, and then it shows that timestamp here. So after your appointment is over, you can go in here and you can fill this agent confirmation form out, and then their information, and their address, plans discussed, date of appointment, and then hit continue here. It will automatically carry over your agent name, and then you'll hit apply e-signature and then sign. So now your scope of appointment has been completed. Again, you can preview this document to review it all, and then you'll just hit save to library. So all of the documents that you complete within CSG, you can store them into what we call your document locker. So think of your document locker as a safe and secure location for you to store all of your completed scopes. So within your document locker, you can create folders for your clients and subfolders. So if you wanted to give each of your clients their own folder with their scopes, or maybe you want to save a quote in here for them, maybe upload an application, we really allow you to store anything in here. It's easy to also add documents. So all you would have to do is click this upload document, and you can choose different files to upload here. So if you do have a folder on your computer that you have completed scopes and you want to move them over to your document locker, you can do that. You can easily search for different scopes, and then you can download and preview any that you have done at any time. That way, if you do need to copy it or upload it to an application, you do have this available. So again, great way to safely store and capture those scopes. If for whatever reason you need to export anything from your document locker, you can always export your library. It will download as a zip file for you. So you'll always have access to those documents that you have completed or uploaded into here. So um, that's a pretty slick tool. Again, you can practice. You could probably see on my account I had tons of test cases on there. So feel free to get in there and just get familiar using it before you use it with an actual client. Same with the e-applications platform. You can get in there and start an e-app, and you can just go into your e-apps, and then you can always go in and edit or delete them. So feel comfortable going through that e-app platform. Just don't go through the actual signature process. So I can come in here. This is one that I started earlier. I can just delete it. Or again, I can go back and edit it. So again, we do encourage you to get familiar with all of the get familiar with all of the tools here. So I'm going to go back here. I know I kind of covered this a little bit earlier, but I'm going to get back to it now that I kind of explained why I had to explain Client Manager to begin with, because I wanted to show you how you utilize Client Manager with the Medicare Advantage quoting, saving, and how all of the client information goes into the e-app. So I wanted to show you that, but again, I want to highlight one of these other features on Client Manager, and that's the option to do a bulk quotes or multi-client quoting. So how that works, again, you would just select the clients that you want to run that bulk quote for, and then when you scroll to the bottom, you're going to have an option here to hit bulk quote. So I'm going to go ahead and hit bulk quote here. I'm going to then choose the effective date of the rates that I want to run the bulk quote for, and then the age of that individual, and then the plan. So I can either select the current plan that they're on that I have in the system, or I can say I want to run a quote for everybody for a particular plan type. So I can select that plan type there. And then I can select the companies. So if I do select all companies, it's always going to return the 3 lowest premium options. So if I just select Aetna Mutual and Cigna, it will just return results for those 3 companies. If I select 10 companies, it will always return the 3 lowest premium options. So you can see here how quickly this system was able to run a quote for everybody at one time. Very slick, isn't it? I know I'm like blowing your mind here. I think this tool is awesome, especially as I mentioned, if you had leads and you wanted to import them into here, or if you wanted to go to your clients who are getting a rate increase and quickly run quotes for them, or maybe you're just, again, going through all of your clients each year. A lot of them, even if they're on a Med Supp plan, everyone thinks of open enrollment as just another time to review what I'm on, even if it's not an MA plan. Some individuals still want to know what's going on. So again, a quick and easy way to run a quote for all your clients at one time. You can see here we'll have all of their demographic information, whether we are applying a household discount to that rate or not, depending on what you have in their client profile, the carrier that they're currently on, what their in-force premium rate is. If you needed to switch plans here and maybe run a different plan type for them, you can do that there. If you needed to go to the full quote results page, you can go to the full quote results page here as well. All of this data can be exported too, so you can go and you can export all of that information. So really slick, easy tool to use there. I'm going to stop now, and I'm just going to open it up for any questions that any questions that have came in before I go into anything else. I know we do have a little bit of time, but yeah, what questions have came up?
I'm opening up here. Give me a second. All right, we have it's like 3 or 4. Can client spreadsheets downloaded from a carrier be uploaded into the? Well, I cannot read all this. Bear with me. There we go. Can client spreadsheets downloaded from a carrier be uploaded to the CRM feature? I guess can you upload basically your
Yeah, so all you would have to do within your client manager, we have these great training guides in the upper right hand corner here. We have a client import example here. So you can use this as kind of a source to be able to see what your column headers need to be as far as how you're labeling them and what data you can bring into the system. But yep, it's just a simple drag and drop of an Excel file or import feature, so you can easily import clients. Just make sure that your Excel file is formatted correctly.
Okay, a couple more here, and I'm gonna someone was asking us about the HIPAA and the RX and the drug feature, which, by the way, if I can just my 2 cents, how cool is that once you enter those drugs in for that client one time? Like we go to Medicare.gov to do that, it doesn't necessarily get saved if you didn't say the number, or I guess all too often I've had to go back and enter some of these nightmare clients that have like 11 medications. So how
Mhm.
cool is it that it automatically saves them for you? I thought that was pretty cool. But they're just asking
Yes.
if that is going to be HIPAA protected, the drugs and the PHI data.
Yeah, yep, it is. And in the next couple of weeks, we're also going to be adding the ability to save providers as well. So
Okay.
you'll be able to also include providers in there. So that's going to be coming here shortly as well.
There's someone else asking you if you're going to provide maybe an email address or contact info at the end. If you're going to or not, I'm not sure. They're asking if you will.
Yeah, absolutely.
Okay. All right. And then one other question here, I can even probably answer this one. Do we know of upcoming rate increases? I mean, they have to file them with the state. So usually 3, 4 months out. Usually carriers give you about a 2-month warning. So yeah, there's ways
Yep.
to find those out, but CSG isn't currently posting that stuff, to my knowledge.
Yep. So in most cases, carriers will give us all of the rates in advance. So if you move your effective date, for example, to 11/1, you're going to
Hmm.
get any rates that we have from the carrier.
Yeah,
So most carriers are great
outstanding.
in getting us all of that data.
Outstanding. That's great. Good, good, good.
Mhm.
And then one more just came in here. Just came in. Can you get rates for carriers not licensed for? Then that's the question. Depends on what your settings are. I mean, I think maybe the situation where your upline maybe only wants to see the carriers that you're licensed with. But there's certainly both capabilities. Kind of depends on your upline. Am I close there, Anna?
Yes, so there especially there's some limitations. Golden Care does a great job in providing you to view a lot of different carrier rates. And then same on like the Medicare Advantage side, you're probably going to see more carriers than what you are contracted to sell. So it's likely you are seeing more carriers than what you are just contracted with to sell, especially on the Medicare Advantage side.
I have a question, Anna, because I do
Yep.
use CSG. So just in the base Medicare supplement quote, put in whatever zip code there is.
Mhm.
Where they have that select plans?
Mhm.
Sometimes a new carrier will come in there, a lower rate. For example, United Healthcare. I just had a zip code. I didn't know how to answer
Mhm.
this. So I hit that select plans button, and suddenly United Healthcare had another offering that was what $17 less than the one I had up. So did Blue Cross
Mhm.
Blue Shield.
Mhm.
So like, and I didn't know if I was licensed to set up or sell that one. So I was just interested where those came from, or it kind of threw me.
Yeah, so some carriers they do offer select plans. Their benefits are a little bit could be a little bit different as far as having networks.
Okay.
So some of those select plans are a little bit lower, but they may not be like a traditional Medicare Advantage or I'm sorry Medicare Supplement plan. So
So they
they may
might be
have like a
missing a benefit of some kind, or like an excess charge or something like this, right?
or like a network, or they have like
Okay.
a net,
Okay.
or they may have certain doctors in network.
All right. All right. I had not seen that or seen that. So that's interesting. Okay.
Mhm.
All right. That's all I have.
Yeah.
That's at this point, that's all the questions we have. So if
Yeah.
you want to move on or go ahead, I'll put you back
Yeah,
on, or
yeah. I'll
I'll
kind
jump
of
off here.
spend some time. I know one feature that was, we talk about being able to quote and compare multiple companies, across product lines. So, for those of you who maybe are not familiar with the actual quoting tool and some of those features, I just wanted to kind kind of provide you just a quick overview on the quoting. I would say most agents, they find our market analytics to be extremely helpful. So I did run a Med Supp quote here, and I pulled in our market analytics. So if you want to see the rate increase history for that particular carrier or any of the market data that we have for them, this comes directly that the carriers have to report each year to the NAIC. So it's going to tell you how many lives are covered at a state and national level. So this market data is very helpful for you, especially to review any of their rate increase information. A lot of agents also find our application health questions to be helpful. So you can put in a certain health condition over here on the left-hand side, and it's going to tell you the look-back period on the application. So it's going to say, in the last 2 years, have you been diagnosed or treated for a heart attack, for example? So utilize all of these underwriting features to your advantage as well. I think one of the most popular features in our quoting system is just the ability to do a universal comparison, or quote multiple plans and provide your client with like a print off or like a PDF, or even save a quote for your reference. So especially as we talk about like different cross-selling opportunities too, just being able to put together a full portfolio package for a client. We have what we call our universal compare tool. So what that allows you to do is, over here on the right-hand side, we have this globe icon. So if you click on that globe icon, it turns the bar purple. We also have our compare quotes. So this is if I was doing like 2 Med Supps, for example. If I just click on the company bar, it turns them green. So my compare quotes box, this is again if I'm just comparing Med Supp plans. My universal compare quotes is if I want to do multiple different products. So for example, I'm just going to throw my Med Supp plan into my universal compare quotes. I'm going to go up here. I'm going to run a dental plan. Again, all I can do is quickly select that client, so it populates their information. I love the client manager piece because it just saves you from having to retype in a zip code or relook at that zip code or ask them again for their zip code. So again, just being able to upload those clients into that client manager to quickly run a quote for them is helpful. So I'm going to run a dental quote here. My tool's just thinking on me for a second. You can find the dental plan that you want to add to their comparison. So let's just say I'm going to add this Mutual of Omaha one. I'm going to click on that globe icon. Now I have a Med Supp and I have a dental, and let's just say, let's go ahead and throw in a final expense in there too. Again, you can do this for like if you were doing a Med Supp with a Part D, you could do, multiple different comparisons here for a client here. This I'm just going to run a $10,000 face value for a level benefit for final expense, but I can select that final expense plan. Now I have 3 plans in my universal compare quote. I have a Med Supp, I have my final expense, and I have my dental. So this is really kind of showing your client a complete portfolio of products that they can receive from you across different carriers. So you wouldn't be able to do this if you were just quoting on Medico's site, if you wanted to write them a different final expense or a different dental plan. So this really allows you to help you cross-sell, but cross-sell against multiple carriers and products. So you can save this as a PDF. It will print off with all of your contact information that you have in your settings profile here. You can also print it too here. So now I have a nice professional quote here. It has my contact information. It has my logo. So if you wanted to upload your logo to here, or maybe a headshot, a photo of yourself, you can do that here. So you can utilize this comparison tool, which is really helpful. So I did just want to quickly show that. So any questions that came in on that in the meantime here?
No, at this point, no new ones. Yep.
Okay.
All right, so you're doing good.
Good. Well, yeah, that's kind of everything that we had planned here. So unless there's anything else that you want me
No, and
to
I think
quickly
that's
cover.
great. No,
Okay.
you know what? I really do think, we do a lot of webinars, and sometimes around that 30, 40-minute time is kind of a good length. It's hard
Yep.
more than that, especially and one thing be live, but no, I think you did a great job. A lot of good features. I saw some things every time I watch you, I pick up a couple more things myself that I can use.
Mhm.
But folks, I would just imagine too, if you have any questions, we can help you. Any follow-ups on this? I know that Lynn is going to send out a copy of what you just heard. You can reply to that email if you had some additional questions or thoughts. Maybe Anna can help us answer if we can't answer them ourselves, but
Yeah.
we're here to help you. So this and many of our other tools, I just want to thank you for coming on board. And Anna, a sincere thanks to you for your help and your knowledge on this thing. We really appreciate you guys spending the time with us.
Yeah,
Andy, you have anything else to
absolutely.
wrap up or?
Nope, that's it. I just always encourage agents after this training session. I know there's always a lot of information thrown at you, so go in, sign into the quoting tool, start playing around with it, get yourself familiar with it. That way you feel comfortable submitting applications on the tool in front of clients and utilizing that scope. Again, the more you practice, the more you definitely feel comfortable with it. So I appreciate everyone's time today, and we're always here to help you find the best ways to be successful, especially during AEP.
Great, great. And listen, I'm just going to say our number too, because it's not on here per se, but 800-842-7799 if you need this or anything else. Talk about the other tools here to gear up for Medicare Advantage season and AEP, etc. So with that, I guess thanks again, Anna, and thanks for coming on board. The number is 800-842-7799 if you need us. But thanks for coming on board, everyone, and good luck selling.
Check out our website, GoldenCare-appointed.com, or give us a call at 800-842-7799.